So I'm presenting here at ASH 2018 in San Diego on the combination KRD, carfilzomib, lenalidomide, dexamethasone, versus the combination VRD, bortezomib, lenalidomide, dexamethasone in newly diagnosed multiple myeloma patients. We used the Commpass database, which is the initiative launched by the Multiple Myeloma Research Foundation, the MMRF, in 2011. There are more than 1,000 patients with a new diagnosis of multiple myeloma that are enrolled in this study. The study was designed to look at both clinical outcomes and genomic markers. So this is the study that has resulted in the genomic sequencing of multiple myeloma. For my presentation, we identified all the patients that were treated with a KRD regimen. There were many more patients treated with a VRD regimen because that's the older version. So for each patient with KRD, we identified matched controls within the Commpass study. So this is a matched data set, so it's a nested case control design within the Commpass study. Looking at the clinical outcomes, we used event-free survival as the clinical outcome. That includes both potential progression, potential death, and also if patients were changing therapy due to clinical decision making. So all those factors would be counted as an event. And the study shows that patients treated with the KRD regimen had a highly significantly favorable clinical outcome. The hazard ratio was 0.35. So that means that there's a 65% reduced risk of progression, death, or changing therapy compared to the VRD regimen. We also stratified the results, patients who got KRD followed by transplant and VRD followed by transplant. And we saw the same hazard ratio. We looked at KRD without transplant compared to VRD without transplant. Again, the hazard ratio was the same. I would lastly like to say that because this is not a clinical trial that's randomized, there are a lot of caveats, as always, but this is the best we have for right now. There is an ongoing randomized trial here in the United States that's funded by the National Cancer Institute, supposedly reading out in the coming year or years, and that will probably be the gold standard. But these results are very strong, and I would expect that the clinical trial will show something in this same neighborhood.